the pool reporter who will ask questions from the media. Janet, over to you.
Good morning, everyone. My name is Janet Pichette. I'm the Chief Epidemiologist with Austin Public Health. And one update I did want to provide to everyone was that on Thursday of this week, the dashboard and case counts will be down for that day because we will be transitioning to a new data management platform to address our ever-increasing number of cases that we have. So if you could please be patient with us as we work through that process and hopefully have the information back up on Friday morning.
Adrian?
Good morning, Adrian Stirrup, Acting Director for Austin Public Health. Proud to announce this morning that our nurse line became active this week. We're really excited about that because it helps mitigate some of the barriers that our communities were facing. And so you no longer need a computer or email access to register for a test. You can just call 512-972-5560 and someone will help you. What we're really excited about is option 3 will give our community access to over 200 languages. So now you will have the ability to register for a test in your preferred language.
Thanks, Adrienne. I'm going to share some slides. Good morning again. It's Dr. Escott. I want to provide some updates regarding our data that pertains to COVID-19. The first slide I'm going to show you is our new confirmed cases. And again, you can see this hockey stick appearance that has formed on the right side of your screen. This represents a substantial increase in our number of cases that have been reported over the past week or so. When we look at our data from last week, compared to the previous week, our case numbers have increased by 90%. So this really is a substantial and exponential increase in the number of cases that we're beginning to see, which is leading to our concern that we shared earlier this week. When we look at that in terms of doubling time, how long it takes that we expect for the cases to double, we can see that we were sitting at about 44 days, which was really good. In fact, you can see from this trend, the yellow line, which is the 7-day moving average of that doubling time, was continuing to increase since the beginning of this pandemic. And then suddenly we see that drop off. So in the past week, we've gone from 44 days to 25 days. So dramatic change, also indicating a substantial change in our conditions here locally. And finally, on this slide, you can see that we also have had a substantial increase in those number of new admissions on a single day. That's the yellow line that you see here. You can see that we were oscillating between about 8 and 10 new admissions a day, and now our 7-day moving average is sustained above 20, which necessitated our movement, along with the other indicators, to that stage 4, which is the more cautious stage, so that we can try to bend the curve again, try to flatten the curve, and try to get a handle on this issue. I do want to point out some new data that we also have, and that's related to hospitalizations and the length of stay. This may be hard for folks who aren't used to seeing these box plot type of graphs, but I'm going to explain it a little bit. The bottom of the box represents the 25th centile, and that means that 25% of individuals hospitalized are hospitalized for 2 days or less. The middle line in that box is the 50th centile. So 50% of individuals hospitalized are hospitalized for 4 days or less. And the top of that box represents the 75th centile, which means that 75% of individuals are hospitalized for 9 days or less. So these are significantly lower numbers compared to other data related to length of hospitalizations. You can see these dots that go all the way up past 70 days indicates other cases. So we do have some individuals who are hospitalized for weeks and sometimes months, but the vast majority of individuals are less than 9 days. So we take this data, and this data is going to be utilized to feed into our model that Dr. Lauren Myers and her group at the University of Texas have been that have been working with us to perform these models, these predictive models, as well as the models for the triggers to help inform if we need to change our predictions or change the triggers in the future due to this new information. We hope to have information on that next week as that model gets revised. Right now we have plenty of capacity in our hospitals. So it's important that folks understand that we're not saying that the hospitals are overwhelmed now. In fact, there's plenty of capacity in hospitals, in our ICUs, and there's plenty of ventilators right now. The concern is what's going to happen 3 or 4 or 5 weeks from now, because we've learned over and over again that we can't wait until the hospitals are full. We can't wait until we run out of ICU beds or ventilators before we take action. And that necessitated that change in the stage earlier this week, and it necessitates change in behavior for all of us in the community to try to avoid that system being overwhelmed. This slide is an update of our demographics associated with hospitalizations. The green line at the top represents our Latinx community. And again, you can see that that community is overrepresented in terms of hospitalizations, with 65% of individuals hospitalized last week being from our Latinx community. You can see that our yellow line is our other category, so we don't know too much about who makes up that group, but the two lines above it are our blue line, which is our white non-Hispanic, decreased and is underrepresented in terms of our population, and the gray line is our African American population, 9.2%, again also indicating overrepresentation of our African American community members in terms of hospitalizations. When we look at our testing numbers, and we've had a lot of questions about our testing numbers. You can see the total number of tests on the left column, which indicates that we've more than doubled our testing in the last week. And we're proud of that. Our teams have been doing a great job at getting folks through the testing. This data is just for our drive-through testing sites, but you can see an overall percent positive of 5.8%, which is not a bad number. But when you look at the details of that number, it shows us a different story. It shows us that 23.5% of our Latinx community is positive that have gone through the drive-through testing. It shows you that our African American community is 7% positive, again, significantly higher than our overall numbers. And our Asian American community is also significantly higher than our white non-Hispanic community. So there's still substantial variation in terms of race and ethnicity when it comes to both being diagnosed right now with COVID-19 and hospitalizations. And with that, I will turn it over to you for questions.
All right, now to our poll reporter, Christopher Neely from Community Impact News.
All right, hey, can you all hear me?
Yes.
All right, hey, Chris Neely here with Community Impact. First question is from us. So when stay-at-home orders were first announced in March, leaders and health officials from across the metro came together to speak as one voice in battling the coronavirus. That hasn't happened since. What level of coordination currently exists between cities and health authorities in the metro, and even between us and other major cities in Texas in containing the coronavirus? And how important is a high level of coordination, especially as we begin to see the surge?
So I'll start off, and the others I think will likely want to comment as well. I think we have a good level of unity happening now. We work regularly with our partners from our surrounding jurisdictions. We work regularly with the state to coordinate efforts. We share case information and dialogue with our neighboring health authorities and epidemiologists. I think what we're seeing is political division happening, and that's concerning because public health should not be a political issue. The things that we're recommending from the city of Austin and Travis County are largely the same thing that the governor's recommending. I saw in his press conference yesterday the stressing of the importance of both the economy and maintaining public health. He stressed over and over again the importance of masking and social distancing and the personal hygiene and staying home if you don't need to be out. Those things are important. Those things we agree on. And I think it's important that we stop the division that's happening publicly. We stop the misinformation that's happening by some groups who choose to create division. And we move forward together as a unified body, as a unified state, as a unified country, so that we can get a handle on this. We simply cannot afford for political division at this stage.
And I'll chime in from the EPI perspective. As Dr. Escott mentioned, we do have regular routine conversations with our epidemiology and health department staff in our surrounding communities, especially transferring cases over to them that belong to them or them transferring cases into us that belong to us. We've also been working closely with epidemiologists from the major metropolitan areas just to see if our experience and the increase in cases is consistent, and just trying to identify ways and strategies to tackle that case investigation activity so that it's good for public health.
And I'll add also from the public health perspective across the region, public health directors and leaders are in constant communication around strategy and implementation. We're working closely with the state health department. We're sharing resources from what the best way to spend CARES funding to the best way to implement mitigation measures. So there is a lot of collaboration throughout the system.
And I would also like to add that from a testing perspective, our testing sites have been open now to our neighboring counties, and we're working with them to, provide a testing solution to help them with their number of people interested in testing. But also our isolation facility that's available has been opened up to include providing that assistance to neighboring counties, because we realize that a lot of people may live in our surrounding jurisdiction, but they actually work here in the Austin area, and we want to make sure that while we're supporting them in those ways possible.
Okay, next question is from the Statesman. Are new cases and hospitalizations particularly severe in cities and counties with higher populations and more density? What trends are health officials seeing in smaller or more rural counties? Is there equal cause for concern in those places?
Again, I kind of touched on this in the last comment, but we are seeing increases in trends throughout most jurisdictions statewide. And again, because we do have, from a population density standpoint, a large number of people who reside in those rural counties who come into the Austin, Travis County area to work, especially with reopening occurring, they may contract illness here and take it home to those communities. So again, we try to stress the prevention message. That's your best defense against this virus. Those things that we've been stating all along, but and if people develop illness, they need to follow up and get testing.
And let me just also say, we've seen this trend happen before. When COVID-19 first came to Texas, we saw that we had cases discovered in metropolitan areas, and we said back then it's going to spread to the rural communities, and it did. When we see a spike in new cases happening in larger jurisdictions, we can also predict similarly that spikes will occur in less densely populated counties. And, we have to remember that this is a virus, not dissimilar from the flu in terms of the ease of spread. It will spread to other communities. It will spread, from large cities to rural communities. But our concern is that the message that's being shared regarding precautions is different between the metropolitan areas and the smaller communities. The message should be the same. The message that you're hearing from us in the city of Austin is very similar to the message that's being shared by the governor, that we have to be safe. We want things to be open. We want the economy to be productive, but we can't do that at the expense of public health. The masking, the social distancing, the personal hygiene are critical messages that we all must hear and must engage in if we want to be safe.
Yes, and just to agree and reiterate Dr. Escott's points, especially in our rural communities where there is often a lack of infrastructure and support, we want to make sure that the messaging is clear for those communities. Again, and I'll say it, I'll sound like a broken record. We want you to mask, we want you to socially distance, and we want you to practice proper hygiene. And we also want to make sure that there's information and tools to put supports in place to protect and promote community resiliency.
Okay, next question is from CBS Austin. We're now in the week when Austin Public Health said that we'd see protests potentially impact the number of new cases. What are you seeing in regards to that? And does the contact tracing questionnaire cover protests?
So we haven't really seen any increase that's been directly associated with protests. But again, it's our case investigation form. It's a case report form that we use that includes the contact tracing portion, but it does cover congregate settings. And so most of the, if not all of the case investigators have been trained to, when they get to that question about congregate settings, to ask if there are any situations like protests that they may have been involved in, so that we can include that information and start tracking that. But to date, we haven't really seen a huge impact. We haven't seen a huge number of cases increasing, but none that have been specifically attributed to the protests. Maybe some anecdotal. A lot of things that I personally have seen in the cases that I've processed have been related specifically to reopening and people wanting to get out and visit restaurants and bars and things like that. Those are some of the cases that I've been seeing specifically, or just, re-entering the workforce and being in work settings that might have cases that are positive.
Let me just add that, as Janet just said, we asked about gatherings, and there's lots of different gatherings. We have Memorial Day gatherings, we have gatherings for parties, and certainly we had large gatherings for the protests. But really, we're focused on right now is ensuring that if people were gathered together, regardless of the reason, and they had an exposure, that exposure is contained. So there is some risk of transmission within that gathering group. And, it's going to be some. We don't know how many yet, but it's going to be some. The real risk is spreading outside of that group. And that's why we took the steps to lower the bar, lower the threshold on testing to make sure that anybody who was gathered in any way over the past several weeks have an opportunity to get tested. And if they test positive, that they can isolate to prevent that further spread. So we'll continue to gather that information, but it's important that folks feel safe in sharing that information. And we want to make sure that when it comes to case investigation and contact tracing, that folks understand that we're not going to share information. We're not going to share information with law enforcement. We're not going to share information with other governmental entities. It is health information. It's private information. It is confidential. And, just like with any other disease investigation, from HIV to STDs to things like tuberculosis, this information is safe and it's secure. and we will not use it in any way to identify individuals. When we do the contact tracing and notify somebody they've been exposed, they never know who exposed them. So it is a very secure way to share information to really help us in public health gain control and keep people safe and healthy.
And I appreciate that, Dr. Escott, because we want our community to understand those protocols and protections that are in place, because we want people to be able to exercise their right to protest, and we want you to be able to do it safely. Masking, social distancing when you can, washing your hands. And I think it's important to note that at the very core of what our community is currently protesting, those systemic inequities that pave the way for police violence also contribute to the disparities that we're seeing with this pandemic. And so, you know, from a public health standpoint, we understand that too is a public health issue that we're working to resolve. And as we partner with our community for any other public health issue, we want the community to engage. We want their voices to be heard. We just want them to do it safely.
Okay, the next question is from Univision. This kind of also relates to gatherings. In the past week, we've seen a huge jump in the number of new cases. Experts have said that this is the result of Memorial Day weekend gatherings. You know, soon we'll see more cases from the protests, and we have Father's Day coming up around the corner. What's the plan to avoid a medical crisis here locally?
Again, this goes back to those simple protections. You know, it's not exciting. I understand people are not getting excited about social distancing. They're not excited about masking or washing their hands. But that's how we control the size of this storm. We talked about this from the beginning, equating this to a hurricane preparation. Except unlike a hurricane, we can control the size of the storm by following those simple things, that simple advice, the washing the hands, the not touching your face, staying home when you're sick, masking in public, and social distancing. Those simple things are the best way we can protect each other, protect our community, and protect our fathers. And I'll tell you that within our City of Austin employees, we've had a number of people who have lost their fathers from COVID-19. We cannot let this continue. We have to protect those who are at risk. And our fathers, my father, is at risk. We have to, I know it's hard for us not to get together with our fathers who are older. It's hard for us not to gather together as families. But we have to understand, if we want to honor our fathers, we have to do it safely. We have to stay apart. And we have to follow those simple guidelines to protect one another.
I agree, Dr. Escott. The social service branch of the EOC did a lot of promotional work with faith-based organizations around Mother's Day celebrations, and we are doing the same for Father's Day. And yes, right, we have to treasure and honor our fathers, and we do this for them. And so a lot of churches have put together visual or virtual celebrations of dads that they'll play during their virtual services. We're encouraging folks to use Zoom to connect, to go back to the old school three-way calling. That's how you can show your father appreciation this day. That is the best gift of love, this gift of separation, social distancing, masking, and proper hygiene.
And I would just like to add on to what Adrian was saying and Dr. Escott. You know, the mask is there to protect the people around you. It's not protecting you, but those that you come in contact with. So should you choose to participate in activities, you need to absolutely be wearing your mask and doing those things that we've been saying, those prevention activities and social distancing. And by all means, if you're sick, stay home, don't participate.
Okay, thanks. Gift of love is the gift of separation. So this next question is from KView. While hospitalizations and new hospital admissions are both on the rise at both the state and local level, the governor and others are saying we still have plenty of capacity and that it's not really a concern. Why are Austin Public Health and Austin Travis County leaders so concerned with the upward trend in hospital admissions? And what would you say about the governor's argument that hospital capacity is not really a concern?
Look, I agree with the governor's comments that hospital capacity is not a concern today. It's not a concern for us today. We have plenty of space. There's plenty of PPE in the hospitals right now. The workforce is healthy and present. That's not our concern. Our concern is 3 or 4 or 5 weeks from now, if this skyrocketing trend continues. At that stage, our hospital capacity could be overwhelmed. Our ICUs could be overwhelmed. Our ventilator capacity could be overwhelmed. We could be facing a shortage of personnel because there's so many patients, or because they themselves are being exposed. So we do not want to sustain a trajectory that we have right now, because we can't. We've seen this happen over and over and over again across the world, that when we wait too long to sound the alarm keeps ringing for weeks and weeks, far surpassing our ability to care for people. And we're talking about the potential, if we wait too long, of exceeding hospital capacity by thousands of individuals in a single day, as far as needing hospital beds that we cannot provide. But it's a nuanced message. The message is we've got to change our behavior today to affect that in the future. But we also must take care of those health conditions that we have been neglecting. We've got to get immunized if we've been putting that off. We've got to get our physical examinations done. We have to go get our medication refills. We need to not delay those elective procedures or those diagnostic procedures that we may have been putting off because of our concerns for COVID-19. The hospitals are safe and healthy today. There are plenty of nurses and doctors and equipment and room for people. But that should not dispel the cautionary note that we must share, that we cannot maintain this trajectory. And we as individuals, we as a community, have to come together to alter the course of this curve. We've got to flatten the curve. We've got to downgrade the storm, because we're in this for the long haul. We've got another year left of dealing with this. So we also need to find that right spot, that sweet spot where we can deal with the infection, but also have a life which is more normal than it has been over the past couple of months.
Okay, next we have a good question from Austonia. Are we seeing new cases among healthcare workers or any clusters inside hospitals or clinics?
So I'll answer that. So we have seen clusters in a few hospital settings. Again, we follow up with those clusters and those organizations to provide guidance or manage those types of outbreaks that might be occurring. Most of our healthcare systems are on top of it. They have infection preventionists on staff who help mitigate those types of issues. So for the most part, I think they're being managed fairly wisely.
Okay, next is from Co-op Radio. Is APH looking into new approaches to influence individuals to act within the published guidance, including state agents like TABC and the State Park Police?
I personally have not heard of any, and I'm not sure in what context they're asking that question, but I've not been approached by any other state agencies related to follow-up of cases from a case investigation standpoint. I don't know about if it's related to enforcement or what the question's referring to.
Is referring to enforcement of guidelines.
Yeah.
I'll jump in and say that I was happy to hear the governor yesterday talk about TABC and the enforcement of bars. We do have an ongoing concern about the risk of disease spread in bars, particularly bars who are not compliant with the state guidance on COVID-19. So I think that we as a city and county are also interested in how we can enforce those things that we can enforce. The governor yesterday talked about the non-enforcement of masking itself, but certainly indicated that enforcement of other aspects may be appropriate so that we can further stem the spread of COVID-19. So we are certainly in discussions on how we can look at the law and potential enforcement actions. So we certainly do not believe that there's any role for criminalization of some of these items, but it is helpful for us to be able to inform restaurants and bars and other businesses that it's okay for you to require masking, that it's enforceable if you decide as your business to not allow people in without masks. I think it is an absolutely responsible thing to do for businesses to take a stand, not only to protect other customers in that business, but to protect their employees. And I think this is a strong position that our business community needs to take in order to ensure that we are doing as much as we can to mitigate that risk of spread, to protect our community, and to ensure that those businesses can stay open.
Okay, the next question is from KXAN. There's a case in Dallas of a woman who tested positive for COVID-19 for a second time, once in February and now again in June. How concerning is that, and have you seen any cases like that in Austin? And what's the status of the Latino task force?
So let me talk a bit about retesting positive. We continue to see stories about this, and it's not surprising. We know that somebody may have the illness, and then they can continue to shed virus or have virus present for an extended period of time. That does not necessarily mean they are infected again. It doesn't even mean that they are infectious still, because you can have dead virus, you can have low levels of virus that are present that do not indicate a substantial risk of spread. But also it's important to know that there's variability in immune response. We know this from other diseases. We've all heard of folks who had chickenpox twice. We've all heard of folks who've had immunization for various things but still get it. There is variable immunity. Some people are going to mount a good immune response and develop lots of antibodies that protect them. Others are not. And that's just a simple fact of disease. So it's not surprising to us that may be the case. It won't be surprising if somebody can get it again. This does not indicate that immunity is short. It indicates to us what we already know, that immunity is variable. And we certainly expect to see circumstances where that could happen. Again, our advice to everybody, whether you've had COVID-19 or not, is to protect yourselves, protect your family through the measures that we've described.
Thank you, Dr. Escott, and I'll just touch briefly on the section of the question pertaining to the task force. This past Saturday, Austin Public Health hosted a Facebook Live event that was for Spanish speakers. We did offer interpretation for those who spoke English, and it really was an opportunity for us to hear from that community about the challenges as well as the successes, and where they would like Austin Public Health to go as we continue to plan the response. Internally, we've done a good job of planning for our communities, but as we're learning, this pandemic is different from our typical response efforts. And so it will be an iterative process. And we want to make sure that our community engagement strategy captures all aspects and facets of our community. So this past Saturday was the first conversation. We have another conversation planned for July 11th that will be focused on all communities of color and be open to speakers of other native languages, Spanish, Vietnamese. We've been talking to or with different leaders in the Latinx community about what our next steps should be. And so I think we've all had the time to do, but as Dr. Escott said, this will be a marathon. So now we're really taking an opportunity to do and plan and strategize in conjunction with our partners. And so as those conversations with community and with key stakeholders develop, we will have a better idea of what type of body would be best served to make sure that there's that constant communication between the community and the planning efforts.
Okay, next question is from KUT. How many case investigators and contact tracers do you think you'll need, and what kind of goes into calculating how many you think you'll need, and how many people are currently working in those roles?
So currently we have upwards to, I'm going to say 48 case investigators that are on staff. We have been onboarding people each week to support that effort. Our goal is to get to roughly about 115 case investigators / contact tracers, to follow up with cases. And the number that we use to calculate that is based on a CDC guidance document on contact tracing and case investigation, where they estimate that we should have roughly 9 case investigators or contact tracers per 100,000 population. So that's where we have. In addition to what Austin Public Health has, we have interlocal agreements with the University of Texas Dell Medical School and Community Care and Central Health, who will also be providing support in some of those efforts. So I know Dell at one point had 20 on staff and could ramp up, and Central Health is working right now to hire on and onboard folks with a July timeline in place.
Let me just jump in. We're going to have to jump off here soon, so if this can be the last question, please.
Yep, yeah, this is the last question. This one's from Fox 7. Can you provide guidelines or protocol for business owners, such as restaurant, bars, when it comes to sharing information about a positive COVID test among employees? Should they immediately shut down, tell customers, et cetera?
So I'll add in here, we work with our Environmental Health Services Division, so we notify them so that they can follow up with that restaurant owner to follow up, as far as like notifying them that they may have a positive case there. We also work individually with those cases to let them know that they will need to be under a control order and that they need to self-isolate at home for a period of time until their symptoms are resolved and they're fever-free. But again, we follow the CDC guidance that's out there and the guidance that the state health department's provided to respond to those types of cluster investigations, and manage it as they come to us. So. And again, we try to stress that everybody, if you're in the restaurant industry or working in a bar, you need to be following, those protective measures that we've been stating over and over today about social distancing and wearing your face mask, making sure that you use proper hand hygiene. And if you're sick, you need to stay home.
I also do want to point out that employers don't have a right to know the medical information of employees. Mm-hmm. Generally, the way that our case investigators will approach this is when they call a business owner or a manager, they'll say that an exposure happened in their facility. There's no disclosure of who that individual was, and there's an attempt to collect information about who else was working during particular periods of time, any customers that may have been present during those particular periods of time. So we go through great lengths to ensure that information stays safe and secure. Certainly if individuals are positive, we encourage them to share as much as they are comfortable with individuals who may have been exposed, because there should not be guilt or shame associated with having an illness of any kind. And, I'm concerned that there's guilt or shame associated with folks who get this. It's going to happen. A significant number of us are going to get this at some period of time, particularly if we don't get a vaccine in a timely fashion. So it's not something we should be ashamed of, but it is something that we need to work together to control. And that means being as open and honest as you can with those who may have been exposed, so they know and can prevent exposure to others.
And I will also like to add to that, just based on the number of cases that I've been working on personally, a lot of businesses and a lot of business owners have actually, when they are aware of an employee who is positive, have required the rest of their staff to go in and get testing, just to be sure that they, can eliminate any other concerns about exposures. But so they have been proactive, and I mean, from an occupational safety standpoint, they've referred people on, and that's across a whole number of different employers, whether it's construction, restaurants, and other facilities.
Okay, yeah, that's all the questions for today. Thanks, guys.
Thank you.
Thank you.
Thank you. Before we wrap up, would you guys like to leave any closing remarks? Start with you, Adrienne.
Sure. Wear a mask if you go out, socially distance, wash your hands, and if you're sick, please isolate either at home or call 311 to get connected to one of our isolation facilities.
And I would just like to add, if for some reason you do become a case and you are contacted by one of our case investigators, know that the information that you share with us is protected under privacy laws. And so it's very, very important that you are able to share contact information with us, and you can do that without fear of retaliation. We don't share that information with any enforcement bodies, but our goal is to try to mitigate and squash an outbreak should it occur within a setting. So we're trying to, as we've been saying for months now, trying to flatten the curve, and that's one way we do it.
I agree with everything they just said, and to stress the importance of what Adrienne said about our isolation facility. We have a hotel that has lots of capacity for individuals who have tested positive, who are concerned they're positive and are awaiting test results, or those that have a high risk exposure. It's a room, it's a hotel room by yourself. You have your own bathroom, TV, internet, you get fed. It's a hotel. I want people to take advantage of that, because we're concerned about the risk of household transmission, particularly in those who have trouble isolating themselves at home. if you don't have your own room where you can stay away from your family, if you don't have your own bathroom, if you don't have the ability to have that social distancing, please take advantage of that free opportunity. We're looking at some other interventions to try to help people isolate better at home if they're not able to utilize our isolation facility. But it's there, it's available, and there are plenty of vacancies there for folks who need it.
All right, that concludes our media availability for today. Thank you to Janet Pichette, Adrian Stirrup, Dr. Mark Escott, and the poll reporter for joining us today. Thank you.
Thank you.
Hey there, everybody, and good morning. Will Dupree in the KXAN Live studio. We do appreciate you all sticking around with us to be able to share this press conference from the officials at Austin Public Health. That included Dr. Mark Escott, the interim health authority for our area, Janet Pichette, the chief epidemiologist, and Adrian Stirrup, who is the acting director for Austin Public Health. Some of the points that they made have been reiterated yesterday by the governor. They fell in line, really. So what we found out, though, and got confirmation of, is that cases have increased in Austin, Travis County by 90% in the last week, which is a concerning trend. And that is not only in new cases, but hospitalizations have gone up at the very same time. That led to Austin, Travis County taking more risk guidelines, putting those out there. We moved now to stage 4, which should make people a little more cautious about what they do and where they go and what activities they take on. So they said that we need to try to flatten the curve again because this trend is not going the way that they would like it to. And really, they said it's because of businesses reopening, people returning to work, going out to do activities, and not taking the proper safety precautions that they should. That includes wearing a mask, washing your hands, keeping distance from people, and if you're feeling sick, stay at home. Additionally, testing is becoming more widely available, so that also creates a factor in that with more testing should come more confirmation of cases here in our particular area. I'm just going back over my notes to make sure we hit every single point. What they also wanted to highlight was that there is an isolation facility so that if you are a confirmed positive case of COVID-19 and you don't have an ability to kind of isolate yourself from your family or loved ones or friends, whomever you live with, there is a facility that is a hotel here in Austin that you can go and stay at. You can access it and potentially book a space there by calling 311. Very simple. If you'd like to know a little bit more about what that looks like, what the facility is, and kind of everything that happens there, our reporter, Alyssa Gord, did a story yesterday. She got an inside look, one of only 2 reporters that were allowed inside yesterday to see what this looks like. And that story is on our website, kxan.com, and the KXAN News app. So please check that out because it is very informative and enlightening to find out a little bit more about that particular facility. I want to show you all where the numbers stand, not only in Travis County, but across Central Texas at this time. So Travis County now has more than 4,700 confirmed cases, and that's throughout this whole entire period since the pandemic began. We've seen triple-digit increases pretty much every day for the last 2 weeks or so, so we're keeping a track and an eye on those numbers. 106 people have now died from COVID-19 here in Travis County. The good news is that there is some more recoveries to share. More than 3,700 people have now recovered after they received a positive diagnosis. And then there on the right, we've seen these numbers for hospitals keep going up. So now 158 people are currently in the hospital fighting COVID-19. 59 are in intensive care, and 28 people are utilizing breathing machines, ventilators, to help them fight this novel coronavirus. Across our area, take a look. These are the number of active cases. So the most populous areas have seen the biggest increases. What we've noticed recently is that Hays County has seen a spike. And coming up this afternoon at about 2 o'clock, an official from Hays County will be talking about the trends that they're seeing and what risks that they have out there for people. So we're going to bring that to you all live on our streaming platforms on Facebook, kxan.com, and the KXAN News app. So you'll have to stay with us because if you live in Hays County, this is something that will pertain to you, some good information to be able to share. So we'll have that at about 2 o'clock. As the health experts just mentioned a few moments ago, the best way to fight this and to protect yourself, it's really simple. Keep a face mask on whenever you're in public. I've got mine right here. It has a fun design. You can have some fun with it to be able to put that on, and you're not only protecting yourself, but you're protecting other people, because a lot of people who have COVID-19 show no symptoms at all, which is the deceiving part, but that mask keeps you protected. Also, keep distance from people that maybe you don't live with or interact with very much at all. That's an important thing. And also just practice good hygiene. Washing your hands for 20 seconds, staying home if you're sick, coughing or sneezing into your elbow to prevent that kind of spread. Really good points to make and to keep in mind that we all should do. Once again, I'm Will Dupree here in the KXAN Live studio. We will see you back here a little later this afternoon with an update from Hays County, so please stay with us.